AtlantiCare is leading the way to healthier communities. We discuss their community engagement, including their life expectancy work and their work with Midtown CDC. It's all here on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Joining me today is Kristen Ragland. He is the Assistant Vice President of Health Equity at AtlantiCare to discuss how AtlantiCare is impacting our communities. Kristen, it's so nice to have you back on the show. The last time you were here was during COVID.
Yes.
So it's great to have you back. Tell me a little bit about your role at AtlantiCare.
Sure. Well, first, thank you for having me, and it's always a pleasure to be here with you, Bert. So my role is the Assistant Vice President of Health Equity, which allows me to not only create interventions with a team of clinical leaders along with non-clinical leaders, but also allows us to identify where there are access opportunities to make sure that people know that AtlantiCare is here to serve them, not only with their clinical and medical needs, but even some of their social, maybe social determinant of health needs as well. And so really excited about the role that I have and the impact that we can present to the community as not only measurable, but even some of the anecdotal stories that come out of it.
Yeah, and I want to get into some of those impacts that you have in the community and some of those initiatives. But I want to just shift gears a little bit to talk about the Vision 2030. Mm-hmm. And I think that's an important step that AtlantiCare has taken to bring the healthcare system to the next level.
Absolutely. So our CEO, Michael Charlton, launched Vision 2030 in April of 2024, which is a 6-year strategy where we are going to transform our community through AtlantiCare. And speaking specifically about the pillar, there's 4 pillars that we're going to do this, right? But the one pillar that I'm responsible for, along with others, is the serving community pillar, which allows us to look at how do we increase life expectancy for our region? How do we look at the unhoused population to see how we can provide solutions to that? How do we look at the food insecure? Because we know that not everybody who has issues in our community are clinical. Sometimes they're social. Sometimes they have to do with needs that we don't necessarily see in a hospital. But sometimes those needs can push them into the hospital because if they're not taking care of themselves, if they're not eating the right things, if they have all these stressors, that can be a beginning, a trigger for something health-related. So our serving community pillar under Vision 2030 sets out to increase life expectancy for our region.
And we want to get a little deeper into that. And why is this so important? Why is the, we think of a hospital, of a health system as just getting, when you're sick, you go there. But you're actually trying to prevent illness through those interventions. Tell me more about that.
Yeah, that's a great point, right? So a lot of people think of the hospital from a reactive standpoint. Right. When I'm sick, when I have pain, I need to go to the hospital. But we want to create a culture in our community. We want to create habits in our community where we can help people be preventative in their clinical and their health journey by having nutritious foods, by understanding that having the ability to live in a safe environment, by understanding some of their social determinant of health needs so we can keep them from coming into the hospital. Why it's important? It's because we are an anchor institution. AtlantiCare is an anchor institution for this region, which means that outside of the four walls of this hospital, we want to make sure that the community knows that we can provide help and resources for things that relate to not the emergency room or the hospital or the doctor's office.
Yeah, and when you think about it, right, avoiding having to go to emergency room because you haven't been taking care of yourself, you haven't done the general visits to your doctors, et cetera. You want to prevent that, right? You want to, the overutilization. In many cases, I guess, there's a lot of overutilization, particularly for segments of individuals and primarily minorities.
Yeah.
So tell me a little bit about why this is important for our minority community, Latinos and African Americans.
Well, you hit the nail on the head, right? There are many subsets of our region, our community, that use the hospital as their primary care office, right? Hey, I'm not going to go to the doctor. I'll just go to the emergency room when it's too late, essentially, sometimes. And so, I'll share a personal story. I have a family member who had diabetes, never knew they had diabetes, never been to the doctors. And so by the time we discovered it, it was a little too late to try to manage it. And so that is always a personal anecdote of mine to make sure that using the platform that AtlantiCare gives me to make sure people go to the doctor, people get screened for their age-appropriate screenings, make sure people have a good relationship with the physicians in their community, the specialists. But that alone is not the only thing that we need to do, right? We can't just rely on people go to the doctor. Are we culturally competent, right? Do we have providers and team members who understand that everyone in our community is different? They require different sets of habits. They require different responses, So do we speak their language? Do we have resources for those who may not speak English?
You make a great point because obviously access to health care has been the major issue for many like Latinos, right? Because of the language, there's been barriers, and certainly how they may get treated at the hospital may not, or the doctors, right, may kind of put the brakes on terms of their access to that health care. So AtlantiCare is taking the due diligence on cultural competency. Break that down for me.
Sure.
I mean, it's not just about being able to have a language line. There's a whole other components to it, right?
Yeah, on top of the translation services that we offer for individuals who don't speak English, we have to educate our team members, right? We have, through our university, which is our educational arm of the hospital and the health system, where we provide education for all team members in various aspects. One of the areas we have is cultural competency. All of our team members get access to education that gives them an insight on how to take care of people at the holistic level, along with from a culturally competent level, meaning looking at historical factors of certain communities, looking at some of the barriers that some minority groups may have always been accustomed to, looking at maybe some of the cultures in home. Maybe there are things that happen at home that may not be something that we're accustomed to. And so when they get to the hospital or they present at a doctor's office, instead of us looking at that as something strange or something that doesn't make sense, we take time to say, well, let's figure out why patients do X, Y, and Z so that we can meet them at a place where they feel comfortable. So AtlantiCare is committed to not only providing care, but we have to educate our team members so that they're culturally competent to take care of a group of individuals. Dr. King, one of my favorite people, says something very profound, right? He says, what affects you directly also affects others indirectly. I can't be what I ought to be until you are what you ought to be. That's the interrelated structure reality. And so what I'm aiming at is that we all have to look at that interrelated structure reality where we're all different, but we can still learn about each other's cultures, traditions, how we do things so that we can treat people with the care that they need.
It's very important. It's very important that you have a warm, welcoming environment, right, when you're looking to get health care. And you mentioned in terms of access, I mean, that that's just one part of access, having the flexibility, the hours, and actually having the physicians available to, specialists, et cetera, are all part of access.
Absolutely. And I think, too, that's why it's important that, and we've done this many times with some of your organizations, bringing some of those specialists, those physicians to the community meetings, introducing them. Maybe they don't need that person now, but there may be a day where their family member or their loved one may need a specialist or meet a doctor, and they had that core memory of, hey, I remember when Dr. So-and-so, the urologist, came to our meeting, or when Dr. So-and-so, the oncologist, came to our meeting to talk about the care in our communities and what they can provide.
So we want to continue this discussion. We want to talk more about the life expectancy work and other work that you're doing outside the walls of the hospital. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Christian Ragland. He is the Assistant Vice President of Health Equity at AtlantiCare. Christian, we just had a good chat about the Vision 2030, the need for access and what all that means, and cultural competency. I just want to touch base about the initiative you have around life expectancy work, and that's very critical, right?
Yes.
That you want to help people to live longer and healthier.
Absolutely. So, there is a saying out there that says your zip code can determine how long you live.
Wow.
And so where you live can determine your life expectancy. And so without getting into to the weeds of the data, but what we do know is that in certain parts of Atlantic County, you live longer in certain zip codes versus others. And the reasons for that is it could be due to the resource. Does that zip code have multiple grocery stores where there's fresh produce and fresh foods? Does that zip code have people who have more access to transportation? Is that a place where people are employed? All of these different things can determine life expectancy on top of the actual health-related needs. And so AtlantiCare has set out to increase life expectancy, knowing those things that I just mentioned as a factor, so that we can begin to create a culture in our communities where we're proactive about living longer and not reactive about some of the things that keep us from living longer. And so under the leadership of my Vice President, Samantha Kiley, who I know you know very well, she continues to lead the way under Michael's vision, Vision 2030, to increase life expectancy in multiple ways. And the area that I'm responsible for is our community health screenings with our clinical team to go out into various parts of our communities to give them access to not only referrals and doctor's appointments, but more importantly in my mind, to screenings that are age appropriate and can let them know if they do need to see a doctor.
The real fact is that in a lot of those zip codes, you do have a large minority population, right? And certainly this is very helpful, right, in terms of making sure that they're following through, that they have access, first of all. One of the issues we have, obviously, is that folks do get a primary care and maybe they don't follow through on what's expected, or the medication or the program that they need to follow. What is AtlantiCare doing about that?
Well, I think one of the ways you can get buy-in from your community with following up on their needs is having a workforce that's reflective of the communities that we serve. And so if we have a population of Latinos who need help, it would be really nice to have Latino doctors and Latino nurses who may be able to connect with that community, especially from a culturally competent standpoint, because they may listen to that person more than maybe someone else. But either way, if we don't have Latino providers, that doesn't stop us from still making sure that we're giving every community the best treatment, but also giving them health literacy. And so one of the ways that we help those individuals follow through on those plans is meeting them where they are. communicating it in a simplistic way, making sure that they understand everything that we're saying to them in the doctor's office, and putting real life scenarios with them, and not scaring them, but more so or less saying, hey, this is what could be the outcome if you don't follow through.
And I know that you're leading a lot of those efforts to do the outreach into the community. I know that you've been a regular with the Hispanic Association and NAACP and many other organizations. So you're really going into the grassroots level to do the outreach and making sure that folks are following through. Very, very important. Now, you mentioned having minorities within the workforce, within healthcare. We're in a education institution, Stockton University, and certainly there's many great careers in healthcare for everyone, and we encourage a lot of the Latinos and minorities to look into those type of careers.
Absolutely, and AtlantiCare, give them a plug. AtlantiCare has a great education investment program for a lot of those clinical careers, from nursing, respiratory therapy, radiology, social work, lab sciences. One of the things I love to gloat about AtlantiCare is that we pay 100% for individuals to go into those fields, and which is great because a lot of those courses can be taken locally right here at our local institutions, if not somewhere else, or even internally at AtlantiCare. And so, yes, I believe that, workforce reflective of the communities that we serve is extremely important as a way, as an intervention to help people follow through on the things that we need them to do to stay healthy and have a life that is longer than they expected. But also, we have to make sure that we are communicating a lot of the interventions that we have, or even undoing some of the false narratives around some things that people talk about as it pertains to healthcare.
And we saw with COVID the disparity that existed there in terms of who's getting vaccinated and who isn't getting vaccinated, and we see also a decline in vaccinations, right? And what is AtlantiCare doing to help making sure the kids are getting the vaccinations?
So I want to plug another thing. So AtlantiCare, we were the recipient of the American Medical Group Association Bridge Award. The American Medical Group Association is an association that really oversees a lot of trends as it pertains to ambulatory settings. And so in 2023 and 2024, we did a COVID-19 study, particularly with Latinos and African Americans in Atlantic City and Pleasantville, to see if they were getting vaccinated or following through on the management of COVID-19. And so we were able to have students from Stockton University help us go into a lot of spaces where there were Latino community members and African American community members and survey them. And we got some really good data so that we could best serve those communities when it comes to COVID-19 management. Going to vaccinations in general, this is a really big topic, not only at the adult level, but even with kids. A lot of people know you can't go to school if you don't have all your vaccinations. And so one of the things that we are doing is we have vaccination clinics. I remember during the flu clinic in Pleasantville, we partnered with our school-based program, Preschool in Pleasantville, which has a really big Latino population of students and parents. And we did a flu vaccine clinic where they were able to come for no cost to get a flu vaccine. But what was important was it wasn't just, hey, come and get a flu vaccine. We had to communicate with them as to the importance of it. So people like Ronnie Lerner and Christine Guzman, who work every day arduously to connect with that community, spent days talking to them about the importance of it versus just saying, come and get your shot. No one's going to trust you if you say, come get a shot.
And I know you also have a number of ERGs, and I know that the AMA, one of the ERGs that my wife is involved with, was critical in making sure that Latinos got the vaccinations and teaming up with AtlantiCare to be able to do that, particularly during the COVID, but certainly looking to continue to work with those ERGs.
Yes, and you shout out your wife, Ivany, so I want to shout her out as well. She's done a phenomenal job of making sure we stay connected in the community, because there are things that we may not know, but someone has to tell us. And once we know, we then start the wheels of partnering and collaboration with organizations and our ERGs. And so, we're all in this together, and teamwork is going to be the method of getting people to have longer lives.
So we're looking forward. I know that AMA is also involved in helping with the Youth Summit this Friday. Yes. Well, it's going to be taking place here at Stockton University. It's high school students from around Atlantic County, about 120 students coming here, and we're going to have representation from AtlantiCare there as well. We need to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion once again with Christian Rockland, the Assistant Vice President at Healthcare Equity of AtlantiCare. And we just had a great chat again, and certainly all the great outreach that you're doing to help lengthen health expectancy, very important work. You wanted to talk about screenings, and let's talk a little bit about that.
So one of the ways we are going to help people with life expectancy is by taking our community health screenings right to where people are. So I have a community health team who goes to different places, faith-based organizations, schools, civic organizations, housing developments, veteran organizations, etc. And we go with nurses and community health engagement specialists. My teammate Maribel Maldonado, who has been phenomenal with getting people set up. But those screenings are for diabetes, for hypertension, and we also set people up for colorectal cancer screening, breast cancer screenings, as well as prostate cancer screenings. So why are we using those five? Those are 5 areas that we feel can impact someone as from a life expectancy standpoint. And so what we hope to accomplish is, outside of the metrics of how many people we screen and how many people we can refer to specialists, but that's also a way for us to connect people to care. Because when you're at the library, when you're at a church and people say, you know what, I was trying to get a doctor's appointment and I didn't know how to, that's our opportunity, our open door to connect them to, resources within AtlantiCare. Also, it's our opportunity to see what type of needs they have, because when we screen them, we also ask them about their housing, we ask them about their food security, we ask them about if they have transportation needs, do they have mental health needs? And so again, it's the community health screenings help us to engage the community, to not only screen them for those different disease states so we can help them with management, but also to get a pulse on the communities that we're serving beyond Atlantic City and greater and even the region.
And we've seen you participate in the Three Kings Day, where there were some screenings being done there, and certainly very much appreciated. There was a culture event with the Boys and Girls Club as well, always out in the community. Now, you expanded the community work by engaging as basically the financial backer for the Midtown EDC. And I know there's a number of them in Atlantic City. I happen to be on the board of the Chelsea EDC, and there's also the Inlet and the Ducktown, all working together. And a lot of the work that it's doing is really addressing some of the deterrents to health, right? And let's talk a little bit about some of those programs. And I know that one of them is housing. Tell me more about that.
Sure. So AtlantiCare is partnered, the backer of the Midtown Community Development Corporation, which extends in a part of Atlantic City that has not only great history, but also some great opportunities to revitalize. And so under the leadership of Samantha Kiley, who leads our Midtown CDC, I get the opportunity to support her, we are looking at housing as an initiative. We have the opportunity to rehab some houses, to resell to maybe lifelong residents who may never have dreamed of being able to buy their own home or may never knew how to buy a home. And so we have a couple of success stories where we purchased homes, we fixed them up, and we sold them back to community members and kept them in their community in the Midtown portion of Atlantic City and outside.
And part of that is the first time home buyer programs that you also run.
Yeah, so there are opportunities. So we do that through education, where once a month in some part of Atlantic City, there is first-time home ownership classes or even just home buying classes to help individuals with how to navigate how to buy a house, what resources are out there to buy a house, what grants are out there to buy a house. There have been a couple times where Midtown has financially assisted individuals with purchasing a home in Midtown. And so we are creating access to education and resources for people to create a lifelong dream of buying a house into a reality.
And the reality is that a lot of the Latinos in the community are renters, right? And increasing the number of homeowners is certainly a big goal that we have to strive for. Tell me a little bit about beautification. I know that's also taking pride in the community.
Yes.
That's also, determines and helps shape that zip code, right?
Yeah, absolutely.
In terms of, you take pride in the community, maintain it, et cetera. So tell me about the beautification.
So I was with the Boys and Girls Club of Atlantic City a couple of years ago, and I was with a couple of students, and I said to them, I asked them actually, I said, hey, when you graduate, what's one thing you want to fix about Atlantic City to keep you to have you stay in Atlantic City? And outside, I thought they would say things like getting a job, buying a house, but the majority of the conversation led around, I want my city to look good. I want to be a part of a city that people are proud to say is their city. And so at Midtown, we have multiple beautification projects. One every month, every second Saturday of the month, we have a team of cleaners who go into Midtown and we clean up the streets, we clean up the parks, we clean up the environment of Midtown, picking up trash and taking care of the community. We have community gardens, as well as we have some art that goes in. We finance murals, we look at some sculpture. One of the things, if you look at a really good city, one thing you'll see is art. You'll see people take pride in having art around their community. They love the murals, and so we take great pride in partnering with some of our art components and organizations in Atlantic City to make sure that there's some really good art that people can look at and take pride in and say that this.
Absolutely. And
Yeah.
One of the things that I'm so impressive about the EDCs is they engage the community, right, and celebrate the community. In other words, get the community engaged. And I know one of the things you're doing is it's a cultural event taking place. Tell me more about
Yep,
that.
June 27th, which is a Saturday, we are hosting our second annual Culture Fest on Kentucky Avenue. And so some people may know from Atlantic City, there used to be something called Kentucky Ave Fest. And so we are just adding more to the culture there, where we're bringing in artists and some local bands to provide some good music while providing resources and vendors and all the things I just talked about, housing and economic development and beautification will highlight that, along with providing medical services, of course, screenings to the community with some food and just a good time to really rejuvenate the Midtown portion of Atlantic City with some art, some fun, and more importantly, some health.
Yeah, and obviously, you see some empty storefronts, et cetera, that you also engage in some of that economic development as well.
Yep, we are very robust in reaching out to our businesses in Midtown. We have grants that individual organizations and businesses can apply for to beautify, whether they're external business or the internal. And so we've had multiple businesses reach out or apply for grants with us and use money to add shelves into their business or paint the front of their business or add new signs for their business. All of this to beautify, to rejuvenate, but also increase the economic development. We also have an application where you can purchase things from a Midtown business and upload your receipt, and you get credit for it, and we get to track, how many people are using our Midtown businesses.
Oh, that's great.
Yep.
That's very telling, and certainly, just taking pride in the neighborhood. And, if you're working with Midtown, Chelsea EDC is doing their part. You got the inlet, and as well as Stockton. A lot of good things happening in the city that goes beyond healthcare.
Absolutely.
But it does help. Absolutely. It's all part of preventing and preventing people from overutilizing healthcare, right? Mm-hmm. And certainly extending the life expectancy as well.
Absolutely. If I have a place where I'm proud to be and I live in that city, I'm guaranteed to do more and to be more proactive about everything in my life.
Well, this has been a great topic, and appreciate you coming on the show. And I'm sure I'm going to have you back soon.
I hope so.
Thank you so much for joining us, and thank you for joining us at home once again here on Latino Motion.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Energy for a changing world. And South Jersey Gas.